Welcome to Ways to Look and Feel Great video series. In this video, I am going to share what I know about acute edema and back pain. Back pain is caused from a variety of problems, including acute pulmonary edema. Edema builds up abnormal and excessive fluids that cause serious actions to the tissue cells. What happens is similar to overwatering plants. The plant will swell and gradually wither away. Edema in acute stages is defined as heart failure to one side, yet the problem extends to cause pain in the back. What occurs is, when the heart is interrupted, it channels the fluids to tubes, vessels, ducts, and passageways that extend to the lungs. Causes of edema. Edema may arise from inhaling smoke, MI/CHF, myocarditis, excessive IOV. Intakes of fluid, valvular disease, overdose of drugs, such as morphine, barbiturates, and heroin. Acute edema arises from ARDS or adult respiratory distress syndrome and atherosclerosis. The lack of heart pumping can cause stress to the chest, which when the chest is scarred, it affects the spine's structure and mobility. Overarching the back is where back pain starts, since the chest is restricted from scarring and/or edema. Experts will often use X-rays, ABG tests, ECG, and monitor hemodynamic to discover edema. Of course, edema can lead to major problems, such as hypernatremia, digoxin toxicity, hypokalemia, excessive fluid, and pulmonary blockage of the arteries, embolism, which starts blood clotting and affects blood circulation. Hypokalemia will decrease potassium intake that is required by blood. What happens is the decrease of potassium to the blood causes excessive excretion of fluids that lead to the muscles, which cause weakness. The back pain is not necessarily the issue at this stage, since the heart is the starting point, which could lead to cardiac arrest. When acute edema is present, experts will often restrict fluid intake while administering IV fluids to substitute. Experts will request that the patient limit fluid intake and join in oxygen therapy. Since edema causes excessive fluid buildup, isometric exercises and bed rest is required. Isometric workouts is the process of pushing muscles next to a sturdy surface, whereas the muscles are put under tension, yet restricted from contractions. The exercises are recommended in a variety of medical treatments when back pain is involved. Edema also affects the joints, cartilages, muscles, etc., which can cause tenderness, ulcers of the legs, changes of stasis, and so forth. Edema affects the veins found in the neck as well, which is one of the leading starts of back pain. To avoid traveling into the heart cavity and discussing heart conditions, I will sum up edema and the causes of back pain. As I mentioned earlier, back pain starts with edema since when the heart is not pumping blood, it affects the connective tissues, ligaments, tendons, muscles, cells, joints, etc. As you can see, when the skeleton elements are targeted, pain will occur from swelling and inflammation. The cause of back pain then starts with excessive fluid buildup emerging from acute edema and/or peripheral edema conditions. To learn more about edema and back pain, consider tendons, ligaments, discs, joints, connective tissues, neurological disorders, and so on. Back pain has affected millions of people, yet the leading causes emerge from nerve and musculoskeletal disorders. Still, many diseases and disorders can cause back pain, including edema. In fact, when doctors discover musculoskeletal and nerve disorders, they often link one of the potential causes to edema. Created by Dr. Steve Young, Philadelphia's top back pain expert, the Back Pain Breakthrough is his online learning program that addresses back pain based on the 508-year-old Leonardo da Vinci's journal, Drawing as Instant Relief. Find out more via the link in description below this video. At the same time, you can check out our blog for more health advice and info at www.waystolookandfeelgreat.com. My name is Jessica Reyes, your presenter for this and future videos on remedies. Thank you for watching this video. Also remember to hit like, subscribe and bell notifications for all future updates.